In this video, I am going to demonstrate the hand anatomy. The human hand is a prehensile organ and is endowed with grasping precision movements for the skilled work. This surface is the palmar surface and behind is the dorsal surface of the hand. The palmar aspect of the hand is covered by thick skin. When you compare it with the dorsal aspect of the hand, the skin is thin. On the palmar surface, the skin is devoid of hair and sebaceous glands. When you reflect the skin, the next layer we see is the superficial fascia, and beneath that we have the deep fascia, which shows the modification of having a band at the wrist called as flexor retinaculum, and there is a thickening called as the palmar aponeurosis, and for the tendons there is fibrous flexor sheaths. So these are the three modifications of the deep fascia of the hand. Aponeurosis, as I mentioned, it is the modification of the deep fascia of the palm and consists of a central part which is triangular in appearance. Lateral and medial part are thin. This central part, it is thick and it's called as the palmar aponeurosis proper. This is actually the distal continuation of, or it represents the primitive insertion of the tendon of palmaris longus. So this is the palmaris longus muscle. It is belonging to the superficial group of flexor compartment muscle. As you trace this tendon distally, it perforates the flexor retinaculum. You can see here the distal part of the tendon itself forms the palmar aponeurosis. This palmar aponeurosis, it protects the underlying tendons, vessels and nerves of the palm. Further, the septa arising from this divides the palm into compartments and also provides origin to the intrinsic muscles of the hand. At the base of the thumb, this bulge is called as thenar eminence, formed because of the underlying thenar muscles. At the base of little finger, this is hypothenar eminence, formed because of hypothenar muscles. But comparatively, the thenar eminence is much more prominent than the hypothenar eminence. The superficial fascia contains fat and a muscle here across the base of hypothenar eminence called as Palmaris brevis. So this Palmaris brevis is a thin strap of subcutaneous muscle, striated muscle. It arises from the flexor retinaculum and the central part of the palmar aponeurosis. So this is the origin of Palmaris brevis and is inserted into the dermis of the ulnar border of the hand. This is supplied by the superficial branch of ulnar nerve and improves the grip by steadying the skin along the hypothenar eminence. So this Palmaris brevis, it represents the remnant of panniculus carnosus. The thenar muscle consists of three short muscles, that is abductor pollicis brevis, So this muscle is the lateral most muscle. This is abductor pollicis brevis. Next, medial to that, we have flexor pollicis brevis, and the last one is opponens pollicis. So to identify this opponens pollicis, I am retracting abductor pollicis brevis laterally and flexor pollicis brevis medially here. So under cover of both these muscles, you can see the fibers of opponens pollicis. This is the opponens pollicis. So these three muscles form the thenar eminence and arises together from the flexor retinaculum and from the two lateral bony pillars of carpal tunnels. We'll see each muscle in detail. Abductor pollicis brevis. This is the most lateral muscle of thenar group of muscles and arises from the flexor retinaculum, tubercles of scaphoid and trapezium, and from the tendon of abductor pollicis longus. So this abductor pollicis longus is belonging to the extensor group of muscles. The muscle is inserted into the radial side of base of proximal phalanx of the thumb and partly into the tendon of extensor pollicis longus. This is the proximal phalanx here. This is the proximal phalanx. So you can see the way the abductor pollicis brevis is going and getting inserted to the proximal phalanx, the base of the proximal phalanx of the thumb. The action of this muscle, as the name suggests, it abducts the thumb at right angles to the plane of the palm and rotates the thumb medially. So both the movements takes place at a joint called carpo-metacarpal and metacarpophalangeal joints. Next, flexor pollicis brevis. It lies medial to the abductor pollicis brevis, and this muscle arises by two heads, superficial and deep. The superficial head arises from the flexor retinaculum and tubercle of trapezium. It accompanies the radial side of the tendon of flexor pollicis longus and is inserted by a tendon to the radial side of the base of proximal phalanx, where it can be interrupted by a sesamoid bone. So you can see here, these are the superficial set of fibers that is going towards the insertion to the base of the proximal phalanx of the thumb. The deep set of fibers arise from, these are the deep set of fibers, these are arising from the trapezoid and the capitate bone, passes deep to the flexor pollicis longus tendon and it joins with the superficial head. Together they are inserted to the base of the proximal phalanx of the thumb. The nerve supply to this muscle, that is superficial head, is supplied by the recurrent branch given by the median nerve, whereas the deep set of fibers, these are supplied by the deep branch of ulnar nerve. So it is having dual nerve supply. The action of this muscle, it helps in the flexion of the proximal phalanx of the thumb across the palm. So next is opponens pollicis. So here you can appreciate the opponens pollicis. This is the opponens pollicis. It lies deep to abductor pollicis brevis and arises from the flexor retinaculum and tubercle of trapezium and is inserted into the lateral half of the palmar surface of shaft of metacarpal, the first metacarpal bone. So here will be the first metacarpal. So you can see here, this is the first metacarpal bone there. So the muscle fibers goes and gets inserted to the lateral surface of the first metacarpal bone. The action of opponent's pollicis is to flex and medially rotate the thumb and assists or helps in the action of opposition of the thumb to bring the latter in contact with the semi-flexed pulps of the other fingers. Nerve supply of the thenar muscles. It is derived by the recurrent branch of median nerve. The only exception is the deep fibers of flexor pollicis brevis, which is supplied by the deep branch of ulnar nerve. Next is the hypothenar muscles. These are three short muscles of hypothenar eminence, and in general it takes its origin from the flexor retinaculum and two medial bony pillars of carpal tunnel. So the muscles are abductor digiti minimi. So this is the abductor digiti minimi, medialmost muscle. Just lateral to that, this is the flexor digiti minimi. When both the muscles are separated in a deeper plane, these are the muscle fibers of opponent's digiti minimi. So now we'll see each muscle in detail. Abductor digiti minimi lies on the ulnar side and arises from the pisiform bone, the tendon of flexor carpi ulnaris and pisohamate ligament. The muscle fiber forms a tendon, small tendon, that is inserted to the ulnar side of the base of the proximal phalanx of the little finger. Next, flexor digiti minimi. This is the flexor digiti minimi. It lies lateral to the radial side of the abductor digiti minimi. The muscle arises from the flexor retinaculum and also from the hook of the hamate. The muscle fibers passes forwards for the insertion into the ulnar side of base of proximal phalanx of the little finger. So here you can see both the muscle, that is abductor digiti minimi and flexor digiti minimi, both are inserted to the base of the proximal phalanx of the little finger on the ulnar side. Next is opponent's digiti minimi. So this is the opponent's digiti minimi there. So this muscle lies deep to the above two mentioned hypothenar muscles. The muscle takes its origin from the flexor retinaculum and also from the hook of hamate, and the muscle is inserted to the shaft of the fifth metacarpal bone. So here is the metacarpal bone. So the muscle fibers, it is inserted to the shaft of the palmar surface of the fifth metacarpal bone. The nerve supply of these three hypothenar muscles are by the deep branch of ulnar nerve. Actions: all the three hypothenar muscles help in deepening the cup of the palm for the proper grip on a large object. The next muscle is adductor pollicis. So you can see here, I am a little bit abducting the thumb so that the adductor pollicis is seen. This is the adductor pollicis. Here you can see this is one more head of adductor pollicis. So this adductor pollicis, it is comparatively deeper in position and it lies beneath the long flexor tendons. Okay, you can see this is the long flexor tendon. So beneath that you are seeing the adductor pollicis. So this adductor pollicis has got two origin. This is the transverse head, and this transverse head takes its origin from the longitudinal ridge present on the palmar surface of the third metacarpal bone. Here, this region is the location of the third metacarpal bone, which shows a longitudinal ridge along the palmar surface. From that longitudinal ridge, you can see the origin of the transverse head or transverse fibers of adductor pollicis. Next, the oblique head. This is the oblique head of adductor pollicis muscle. This oblique head arises from bases of second and third metacarpals and the adjoining trapezoid and capitate by a crescentic origin. Both the heads, as you can see, they proceed forwards and laterally or converge into a tendon for the insertion to the ulnar side of the base of the proximal phalanx with the sesamoid bone intervening. So you can see that this is the base of the proximal phalanx. On the radial side, you have the insertion of abductor pollicis brevis and flexor pollicis brevis. On the ulnar side of the base of proximal phalanx, there is insertion of both the heads of adductor pollicis. Action is when the muscle contracts, it approximates the thumb to the index finger from any position of the thumb. The nerve supply of this muscle is by the deep branch of ulnar nerve.